Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Expressing your pain. Introduction. Patients recovering from surgery and receiving treatment at the hospital or medical center may have pain. Pain is generally a good sign of something going wrong in the body. However, when it is not treated adequately, it can cause severe discomfort, inability to move, sleeplessness, depression, and can slow your recovery. Usually, pain can be relieved with medications and non-drug treatments, but you must first alert your doctor and nurse to the pain and then describe it to them. This program explains how you can describe your pain to your healthcare provider. Identifying your pain. You are the best judge of how much you hurt. Talking about your pain with your doctor or nurse will help them find a treatment that eases your discomfort. It is often helpful to your healthcare provider for you to describe your pain so that together you can discuss possible treatments for your pain. Be sure to consider the following points when talking with your doctor and nurses. Indicate where the pain occurs. This is sometimes easy to do by pointing at the pain site, but sometimes it is difficult to locate the pain exactly. For example, it is difficult to tell which tooth is hurting when you have a toothache. Indicate if the pain travels or radiates anywhere else. For example, you might tell your doctor, "The pain starts in my shoulder and then spreads to my upper arm down to my index finger." Describe how often you have the pain and how long the pain lasts. Describe your pain. You can use phrases like cramping pain, sharp pain, shooting pain, or stabbing pain. You can click on each of these descriptions to receive an example. List other signs that come with the pain. For instance, do you feel nausea or dizziness with the pain? List any treatments that you're trying in order to help relieve the pain. For instance, indicate if you are trying over-the-counter medications, vitamins, or non-medical treatments to relieve the pain. Tell your doctor whether you have tried physical therapy, chiropractic treatments, acupuncture, etc. Be sure to mention if you are taking part in a chronic pain program or have been taking narcotic painkillers for a long period of time, daily for 6 months or more, as this will help determine the type and amount of pain medicine you will need in the hospital. List things that make the pain better or worse. For instance, indicate if any of the following helps relieve the pain: medicines, heat or cold, sitting or lying. List any changes in the type of pain you experience. Pain scales. In order to treat your pain adequately, your healthcare professionals need to determine the amount of pain you have. Unfortunately, pain cannot be measured in pounds or inches. Pain can only be measured by the patient. Thus, pain scales have been devised to allow patients to rate their pain. One of the most common scales rates pain from 0 to 10. In this scale, 0 is no pain, 5 is tolerable pain, and 10 is the worst pain. The rest of the numbers allow patients to further define the amount of pain they are experiencing. For example, a 7 may be a pain that prevents you from doing strenuous activities, and an 8 may be a pain that prevents everyday activities. The good thing about such a scale is that it allows different healthcare professionals to follow how your pain changes over time. It also allows them to assess the effectiveness of any pain medications they give you. Sometimes the scale is given in faces as well as numbers. A smiling face is a 0 or no pain, and a very sad face is a 10 or excruciating pain. This type of scale can be helpful for patients who cannot read, allowing them to merely point at the appropriate face. This scale is also useful for young children and patients on respirators. Patients are also often asked to determine which level of pain they can put up with without necessitating medications. This is something we call the comfort zone. Most patients' comfort zone falls around a 2 or 3, but this varies from patient to patient and there are no right or wrong answers.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment. Pain medicines are often given to relieve pain while you are in the hospital. These are generally given in one of 4 ways while on the surgical unit: IV, injection in the muscle; orally, transdermal patch. IV medications are given for a few days for acute pain. This type of medication works quickly but only lasts for a short period of time. These may also cause nausea and vomiting, which can be controlled with other medications. You may also have a PCA, patient-controlled analgesia pump, most commonly used after a surgery. This is usually only used for a few days. It allows you to push a button to give yourself a dose of IV medication to relieve pain. If you have a PCA, we encourage you to use this as often as possible at first to remain comfortable and allow you to perform activities. If you feel it is ineffective, there are other options to help relieve your pain. Medications that are injected in the muscle are rarely used due to the possibility of damaging surrounding tissues. This medication takes longer than the IV to work, but lasts slightly longer. Oral medications take about 30 minutes to start working. However, they can last hours longer than the IV or intramuscular medications. As soon as possible, you will be started on oral pain medication to assure that these will be effective for you when you are able to go home. The nurses can provide you with information regarding the types of pain medications available to you and how they will be given. They can also describe side effects and how to minimize them. Treatments that do not require medications may include ice to the affected area, heat to the affected area, change in position, distraction. Be sure to let your nurse know if any of the treatments used to relieve your pain are ineffective in helping you to reach your comfort zone.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Always acknowledge your pain and describe it to your doctor and nurse in as much detail as you can. Pain scales are very important in helping patients convey the amount of pain they experience. Use them to express the intensity of your pain. They are also very important in helping healthcare professionals follow the evolution of your pain and the effectiveness of your pain medications. Together, you and your healthcare team can achieve a level of comfort that will allow you to rest, work with physical therapists and nurses to increase your mobility, and head you towards home. Thank you for using Explain.